All right. Well, hello and welcome to Virtua Health's Real Talk Women's Health Chat. My name is Nicole Michalik and I'm from 92.5 XTU, Philly's country station. I just finished my shift and I'm thrilled to be your host for tonight's event. So I'm going to give you a few helpful hints first before we get started. Your camera and microphone are turned off, but you can still ask our panelists questions through the Q&A tab. And you can choose to submit questions anonymously. So if you're like, oh, I feel it's a little much, you can do it anonymously. And our experts will answer your questions toward the end of the session. And a number of you have already submitted excellent questions for our expert when you registered. So that's awesome. And we're going to incorporate many of those into the discussion. So that's very exciting. Okay. Now, if you prefer to have closed captions on, what you're going to do, you're going to click on the live transcript button at the bottom of your Zoom screen. Give you a second to see that. So bottom of your Zoom screen, and then you're going to select show subtitle. You can adjust the size of the font by clicking subtitle settings. And then you should see the closed caption at the bottom of your screen. I know it's a little confusing, but listen, we're all going to be tech savvy before you know it. All right. So let's jump into it. I'm so pleased to introduce three Virtua experts tonight. Female pelvic medicine physician, Kristene Whitmore, breast surgeon, Lori Timmerman, and primary care physician, Denne Patterson. Oh, so excited to be here. Dr. Whitmore attended Hahnemann Medical School and completed her fellowship training at UCLA Medical Center. She is a certified in female pelvic medicine and reconstructive surgery and urology. Dr. Whitmore loves traveling around the world and experiencing different cultures and foods. She enjoys a good book and listening to music. Hopefully it's my radio station. Dr. Timmerman has been with Virtua since 2017. She went to medical school at Philadelphia College of Osteopathic Medicine, which is actually close to the radio station too in Ballackinwood. And she also did her surgical residency there. She's a mother of 4 children between the ages of 9 and 15, and they obviously keep her very busy with their social lives and activities. Dr. Timmerman likes to run with her dog Myrtle and enjoys cooking with her kids and spending time at the shore. Dr. Patterson attended Eastern Carolina University School of Medicine, and she did her residency at Crozer Chester Medical Center. She recently received a local award for Distinguished Mother of the Year for the work she's done with local youth. And Dr. Patterson has recently added rowing to her list of hobbies and is hoping to join the Cooper River Row team. So cool. So welcome, everyone. Yay. All right, so we've had some attendees ask what they should be doing for their health. Obviously, we call this, the wonderful world of our bodies, and it's important to ask the questions, right? If they eat healthy, if they exercise, they get enough sleep. And what are some other areas that we should be mindful as we age?
So I think getting your screenings on time and in a timely manner is very important, especially for breast. So start at age 40, unless you have a family member who was diagnosed early, then you're 10 years earlier than that diagnosis. And self-breast exams are extremely important as well. So we should be starting them way earlier than 40, just to sort of get to know your breasts, because your breasts do change over time and they're changing as you age. So your little lumps and bumps that you notice, you got to get to know what's normal for you. So if you do have a change, that you would be aware.
Yeah, don't you find it too sometimes that women feel, oh, I don't know if I should do my self-exam. Oh, it feels weird to touch myself. And we want to encourage women, touch yourself, get to know your body. I think this is something we really should stress here tonight too, where women, I think for so long were felt that maybe we shouldn't do that. Now it's like, no, the more you know about your body, the better.
Oh, definitely.
I tell my patients that I see your breasts once a year, but you see your breast every day. So, you have to listen to your body. I think, touch yourself is important. I think if you have teenagers, you should encourage them to look with a mirror and to teach them how to do breast exams in the shower. I mean, I'm not saying get in the shower with them, but teach them how to do it when they're in the shower. And I really think that we just need to listen to our bodies more. A lot of times our bodies are trying to tell us things and we're just ignoring it. And I don't want people to have pain, but pain has a reason. Pain has a function. When there's something uncomfortable or something different, it's telling you something, and you have to listen to our bodies more.
And this is a really good point too, in regards to family history and especially diabetes, how you should be mindful of your mental health, because changes in blood sugar can cause rapid changes in your mood. And that is something that I think people don't really make that connection with, that we should really talk about too, is that the mind and body connection.
Absolutely. Absolutely. Listen to your body, listen to what it's saying. And I recently, I didn't grow up with yoga. It just wasn't something that I knew about. And I just recently embraced it. And when I get up in the morning, I just say, okay, let me listen to my body. What's going on? And I just find it relaxing and enjoying. And I've taught it to my daughters because I want them to be able to listen to their body as well, and be able to understand what it's saying, and not, wake up and be 40 and finally, figure out, oh, that's what's going on.
Well, yeah. And really quick, because there's obviously we got to keep moving, but my brother and sister-in-law just had a little girl, my first niece. She's okay, but she's 8 months old, and how she just naturally knows how to stretch, right? She doesn't understand what that means, but like, I think that that's so important, because we don't do that when we get older, right? We kind of like get out of bed, but it's like, when it's so biological for an infant, you see they naturally do it, and then somehow we forget about it. So it's like retraining our brains that like, this is important, stretch and do the yoga and do all those things to, as preventative measures to, keep us. Look at Tom Brady. We get, he says being limber is why he's still playing at almost 45.
Probably very true.
Yeah. So obviously we want to talk about essential screenings, preventive care. I'm going to go down the list of stuff that we know, and if there's anything else to add to that. So we have, blood pressure, cholesterol, glucose. We have our DEXA scan, which is the bone density, mammogram, pap smears, colonoscopy, skin exams, and routine dental exams. Is there anything else you could think of that we should add to the list, or is it just we start with those, and then as we need something else, we go with it?
I like to talk about the 4 Ds. And the first is diet. So make sure you're eating healthy, high plant-based diet, low carb. Well, we can talk about diet later, but high plant-based diet, first of all. So that's the first D. The second D is doctor. So see your doctor, and all those things you just mentioned. If you go to your doctor, they will make sure that you're getting all the health screenings that you need. So you don't have to necessarily memorize it. They'll know you're 30, they'll know you're 40, 50, etc. And they'll be able to tell you the health screenings that you need based on your family history and your symptoms, etc., etc. So see your doctor.
Yeah.
So the doctor can help you with those things.
And then and family history is so very important too. Genetics are very real. And look at me talking like I'm a doctor, but my doctor talks about it a lot. And I think it's important to like genetics are a real thing. And so family history is important to stay on top of those things.
Well, a lot of times people come to me and they say, I don't have any family history of anything. And I don't believe that. So I take the next step and I say, well, are all 4 of your grandparents still living? And invariably, people say no, if they're my age or older, they say no. And I say, well, then what did they die of? Because a lot of times people say, oh, they died of old age. Well, even if they died of old age, something had to happen, right? Whether it was their heart or their kidneys. So I say, well, then your homework assignment is to go ask your mom or your auntie or whoever what happened to grandpa. So you're right. Absolutely. Family history is very important. So let me say the other 2 Ds real quick. So the third D is do exercise. I know I kind of tweak that in there a little bit, but definitely do exercise. because we keep our bodies and our bones and our muscles limber as we get older. And then the fourth D is danger. So avoid injuries. That's one way to stay young. I saw one of the questions was, how do we stay active and vibrant as we age? And it's one way is to avoid injuries, because there's all kinds of statistics. If you break a hip, you're when you're over 65 and you break a hip, your life expectancy goes down. If you have a major accident, then you're in pain and your quality of life goes down. And if you're overweight and you're trying to exercise, but you hurt yourself, then you kind of put yourself backwards and you don't get to exercise. So danger, avoid injuries.
Awesome. Dr. Whitmore, you were about to say something too in the beginning. Do you remember what that was?
Well, I don't think we should forget about some of the untalkables, such as having your urine checked.
Yes.
50% of women will have a urinary tract infection or UTI. They can become recurrent, and they can also lead to other problems. Also, don't forget about your bowel habits. If you have a change in bowel habits, especially if you have a family history, don't be afraid to talk about it with your physician. Your primary care provider can be very helpful in that regard. And if it's a persistent problem, there are specialists available that specialize in urinary problems, bowel problems, breast problems, and everything else.
Yeah. And, I do think too, a lot of people are, oh, I feel weird taking a urine sample, but oh my God, a stool sample. And it's like, yeah, like we're pooping every day, or hopefully we're pooping every day. So it's like, do not be afraid of the poop. There's a lot to learn by your poop. So again, this is, people, I know it gets a bad rap, but I think it's important to embrace the poop and know that, like, if you're having an issue, it's okay to get it tested. And it's amazing that we live in a time in 2022 where we have all these tests available, that we can do all these things and learn all these things and have these amazing doctors who understand all these things. So don't worry about that.
Absolutely not. And certainly if something changes, it's not normal to wet yourself. It's not normal to have leakage of bowel. It's not normal to feel a bulge down below when you stand. I mean, there are things that happen with childbirth, menopause, just natural aging that you don't have to just live with. There are people out there who can help you with these problems.
Absolutely. Okay. So we're going to talk about pelvic floor in a minute, but let's talk about menopause, because obviously that's something that women need to talk about, probably don't have all the questions. Skin changes. Obviously, a lot of women get upset with the pooch, or what's called the menopause belly, night sweats, hot flashes. So just talk a little bit about menopause and how women could get ready for it. And then when they're in it, what they can do to kind of ease into it.
It's definitely something that our mothers didn't tell us about, or they don't prepare you for in health class or whatever when you're in high school. So we need to talk to each other and, prepare the younger women that are coming up underneath us in our tutelage. So, I mean, there's all kinds of things that happen. Because of the hormones, you get hot flashes, you get extra hair growth, your metabolism slows down. So you may not sleep as well. You don't lose weight the same way that you used to. You start getting those bulges. I'm not saying
do not get enough credit for what we have to go through. Right? I mean, let's give ourselves some snaps, right? Like, come on. It's a lot.
Absolutely. I mean, I'm not saying 100% embrace it. I'm just saying it is part of aging. The same way that we wouldn't have teenagers beat themselves up about getting acne or getting menstrual cramps. It is a part of aging. But with that said, to try to mitigate symptoms, there's some over-the-counter remedies. I think that you should definitely talk to your doctor about prescription remedies if it's interfering with your life, because it does matter if you haven't had a history of breast cancer, a family history of breast cancer, what things you can and cannot take. You may get excessive hair growth. There's all kinds of ways to limit hair growth. It may be electrolysis, or talk to the dermatologist about, ways to get rid of that extra weird hair growth. But as far as the muffin top, I think they call it, one, I saw one of the questions was, they do all kinds of belly crunches and it doesn't go away. Well, what happens when you're doing the belly crunches is you're strengthening the muscle underneath, but you have to do it so consistently, which is good. If you do it consistently, it tends to go away. But you also need to do cardio to also burn some of the fat. And I found I have 4 children, and I gained 60 pounds after my last baby. So I was much, much heavier. And I found a Jamaican woman told me this. She told me to hula hoop because all those crunches were not doing it for me. And so what I do is, I wish I had it here. If somebody else talks, I'll go show you what my hula hoop looks like. But it's a 3-pound hula hoop. I got it from Target. Right? It's not a commercial for Target, sorry. But I got it from Target for, I don't know, $40, I don't know. And I hula hoop. So that's how I answer my text. I'm hula hooping. I'm answering my evening text, and I'm sending texts, and I'm answering my emails. And when my girls were younger, I bought them the dollar store hula hoops, and we would hula hoop on every commercial. So your kids will remind you, Mom, it's commercial. So we would jump up and we would hula hoop. And then, once you make it through a couple of TV shows, you've already hula hooped for 30 minutes, and that's your day. So that's just,
and then when you go to Hawaii, you can say, hold on, I'm joining
the Yes. So that's just my suggestion. I'm sure the other women have other suggestions.
Well, as we get older, simple things like just walking on a regular basis, taking a basic yoga class, learning how to breathe properly. And if you are in the danger zone and have had an injury, getting the appropriate rehabilitation, which Virtua does very well. We have great physical therapy available. We have wellness centers, but sometimes you can't just hula on your own, although that sounds like a great idea, Dr. Patterson, but sometimes you need a little prodding. So sometimes you need to go to a class or watch a video. Sometimes that's very helpful.
That's awesome. Okay, let's talk about pelvic floor. Obviously, there's a lot of women who are joining us that are moms. And as we age, parts start to sag. That's just what it is. So does our vagina. And we're saying vagina. I think a lot of women are like the hoo-ha or, the woo-woo, but it's like, this is medicine. We're going to say vagina. And your pelvic floor muscles could be weak. They could be stretched. They could be torn. They could prolapse, incontinence. And is there any ways to strengthen your pelvic floor? And this is an interesting conversation for me because my mom just found out that she actually has to get surgery for her drop bladder. And it's like a whole big thing in the family because she's babysitting my niece and she needs a planet. So she could, she can't lift, I think, for like 6 to 8 weeks. So I was very excited that we had a pelvic floor specialist that we could talk about this.
Well, if you've had a vaginal delivery, especially multiple deliveries, or if you've had a traumatic vaginal delivery, a la forceps being used, or an emergency C-section, you're at higher risk for getting leakage of urine, for example, when you cough or sneeze, or feeling a bulge in your vaginal area when you stand all day at the end of your shift, at the end of the day. You may also have leakage of stool. But you can also have an overactive bladder, for example, which can happen in the view of some of these other issues. But the bottom line is these can happen and they are not normal. And there are many things that can be done. The first thing we can start with is pelvic floor muscle exercises. Your OBGYN or whoever's doing your pap smear can check to see if you're isolating the muscles properly. If you are not, we have pelvic floor physical therapy, which can teach you how to use the muscles properly. And if after you've done your physical therapy, your home exercise routine, and you still cannot function normally, then it's time to talk about more invasive things. But so many times people can be made much better with some dietary modifications. For example, if you get up several times at night, if you drink a lot of caffeine, there's something called the bladder diet, which can actually slow the bladder down. And there are other supplements that we can give that will also be helpful, and several medications as well. But the bottom line is pelvic floor problems are not normal and they can be addressed, but you can't go to your primary care provider with a crystal ball and hand it to he or she. You have to be willing to talk about it. There are questionnaires that we can give you that help teach you about your pelvic floor, how your sexuality is. Do you leak urine? Do you feel a bulge? Do you have problem when you are pooping or evacuating? Do you have problem getting the stool to come out? There are questionnaires, if you're a little afraid to talk about it, that can be given to you when you come to an appointment, and then we can discuss it in detail. And another thing that's very important is to go to a healthcare provider that will do a very detailed examination. Not just test the muscles, we can measure the degree to which the bladder is coming down, to which the uterus is coming down, to which the bowel is coming down. We can, in addition to giving you pelvic floor muscle exercises and physical therapy, we can put devices in to hold things up, something like a ring device or a pessary. Or we can just observe it if it doesn't bother you so much. But just knowing about it and knowing that there's help available is a start. And then there's always the menopause issue and whether or not to use hormones. And people often ask about the risk for breast cancer. Dr. Timmerman.
Yeah.
Yes. Yeah. So, so I get a lot of people that sort of get screened by their GYN first, which is great because I think, lots of people have a good relationship with their GYNs and they're talking about a lot of these things and family histories and other things that have happened with their breasts in the past, if they've had biopsies in the past and that kind of a thing. But they sometimes by the time they get to us, a lot of this is sort of sorted out. But it is good to, family history is super important. So we go over all of that in detail. And then when you come to a visit with us, if you think you're a high risk or you're worried about your breast density, because people with very dense breasts sometimes need additional screenings or extra exams. We put all of these things into like a calculator and try to figure out what your lifetime risk is. And if you're higher risk, then we screen you extra.
Can you explain what it means? You hear that term a lot, dense breasts. And for people who don't know what that means, can you just explain that a little bit?
Yeah, so very common for younger females to have dense breasts. Just their hormone levels and they're young and everything's nice and firm. But so on exam, their breasts are a little bit harder to examine because they're not as fatty. Fatty breasts are softer, a little bit more mobile, and a dense breast is sort of like how it's dense. It's a little harder. So to feel a mass or something like that can be more difficult. And we see it a lot on mammogram reports. So anybody who's getting their mammograms regularly, New Jersey has a law that at the bottom of the report it says, what your breast density grade is, A through D. And they have to make you aware. So they will give you a grade from A being the least dense to D being extremely dense. And what that means is on your mammogram, your breast looks very gray, white in the middle. A fatty breast will look more black in the middle. So it makes it sometimes a little bit more difficult to see because a mass will show up white or like a grayish white. And calcifications that we're also looking for, sometimes they're white too. So it's hard to see on a regular 2D mammogram, somebody who has dense breasts, to try to find a mass. So we love 3D mammograms because we can sort of scroll through the breasts and see them a little bit better. And it's definitely easier with somebody who has a denser breast.
And what about textures and bumps? And should people be, I guess it's like, when are people concerned, or it's more of, if you are concerned something has changed, just call your doctor. There's no harm in that.
Basically, that's a good rule of thumb. If you notice a change and you're not sure, I wouldn't wait. We never mind to ask. It's always better to ask and have somebody tell you, oh, it's nothing, than to leave it go and to actually be something. So if you're worried about it, nobody's going to get upset if you come in and ask and say, hey, I think this is new. Because we would rather check it over, make sure everything is good, than have somebody worry about it.
Yeah. All right, let's talk about sex. Let's talk about sex, baby. So we go through a lot in our lives. Women go through so much in our lives. There's really great questions that are coming in. By the way, don't forget you can do the Q&A. So we're going to get to that. And we want to talk about sexual desire and how different things in our lives can affect that. So is there a way to increase our libido? So again, one of those things where women don't really talk, we're told not to talk about sex, and we're like, we're talking about it all here tonight. So let's get into that. Obviously, I know with age and menopause, there could be women that suffer with dryness, connection with depression. Obviously, after breast cancer, there's a lot of things there. So let's talk about sex.
Well, desire is only part of it. You also have to talk about arousal or the ability to lubricate. You have to talk about pain with sex. Can you have an orgasm? And oftentimes there's a big overlap with all of those categories. For example, if someone has pain during sex, there's a 51 or more % chance they're going to want to avoid to have sex. Okay, let's go back to desire. It's not just the hormones, it's our lifestyles. If you've got 4 kids at home and working 12 hours a day.
And an annoying spouse, that could affect it.
So certainly life gets in the way, and relationships are very important. If your partner has an issue with sex, there's more than a 50% chance you're going to have problems with sex. So a good relationship with your partner is important. Sexual counseling is available. We certainly have a few of those in the Virtua system. So then we talk about lubrication. Yes, as we start to get a little older, we can have problems with lubrication. So we can use moisturizers or lubricants. Moisturizer would be something that you use on a routine basis. And a lubricant is something that you would use before and or during sexual activity. And moisturizers, simple things. There's Replens. There's all kinds of companies that have these. There's natural things such as coconut oil, especially organic coconut oil is cheap and works very well. Lubricants, you get a water-based. We like one called Uberlube, which was actually originally developed as a hair gel to make your hair shine, but it's actually quite a wonderful lubricant for sexual activity. And if you've never had an orgasm,
I mean, it's hair gel, so I wonder if it works with pelvic hair too.
Well, most people nowadays, it's more fashionable not to have a lot of hair down there. So I don't know.
Can we talk about that a little bit? Actually, that's a really good transition. Is there a pro or con for that? Because I know with my age group, especially, it's like, no, we're waxing, we're laser hairing. But my mom's age, right? Like they were like, let's, free the bush, right? So like, is there a pro or con with vaginal hair?
No, I don't really think so. But if you shave, there's always the risk of causing abrasions and damage. Right. So if you're going to choose that mode, just do it safely. But no, there's no evidence in the literature that would report having hair or not having hair changes the incidence of urinary leakage, urinary tract infection, or any other pelvic floor disorder.
I know that I have had multiple patients that are shaving. I had a young person that's maybe like 25 or 26 just last week. They were in the hospital for sepsis because they were shaving between their buttocks cheeks and got a cut, and they were too embarrassed to actually go and get it checked out. Waited till they started having fevers and chills, ended up in the emergency room. And of course they're checking them for COVID and everything, but they didn't tell them that their buttocks was hurting, and were admitted because the fevers were so high and got, a spinal tap, got all this before they actually told them, well, actually my butt is hurting, and because they were so embarrassed. So I I would just caution people, if they are shaving themselves, waxing is one thing. I have people be irritated to the wax as well and come in with skin infections. That's a whole different thing. But if they're shaving themselves, it has to be a clean razor. Don't have something that's nicked or dirty, because you can, get recurrent infections and boils. Just a little aside.
Yeah.
Never be embarrassed to say what the problem is. We have heard it all.
Yeah.
There's never any, ever. And the information
Listen
doesn't
to
go
your
there.
body.
Yeah.
Yeah. I mean,
Yeah.
I think Dr. Whitmore is very, very correct. I mean, some people, alcohol, gets them aroused, and some people, it actually takes away libido. Some people, exercising makes them extremely tired, and other times people exercising actually helps get them in the mood. Losing a little bit of weight, and I'm not talking about a lot, but maybe like 5 to 6 pounds sometimes helps people with, being able to engage with their partners. That's not hands down, but I have heard some people say. And then sexual hygiene, about, staying clean and having, having the area lubricated, as Dr. Whitmore was saying, all those things can help with sexual health. But I will say, I am with the same person that I've been with since I was 13, and I'm not 13 anymore. And, the bodies change, so we were one way when we were teenagers, we were another way when we were in our 30s, we were another way when we were in our 40s, and beyond. And he's changed, I've changed, and I think that having a partner that you can talk about and appreciate, and maybe not be embarrassed, sometimes that helps. That doesn't, it's not 100%, but sometimes that helps, just knowing that things change. I'm not 20 anymore. Things are different. You just have to, understand that.
And also, we're going to get to the questions in a minute, because there's a lot of really good questions coming in. But also, I think it's also important to remind women too, even as they get older, about STDs and safe sex, right? Because people think, oh, well, I can't get pregnant. And you're like, well, but you can get an STD, and we're about like, if you're feeling it, if you're in the mood and you want to have fun, do it. It's just be safe about it. And I think that's something to remind women too, that that's very real, that STDs, they come at you no matter how old you are.
Absolutely. That's for real.
Yeah. All right, let's get to some questions. And we got some really good questions. So the first one is, are pelvic exams needed for women who are over 70?
Well, the American College of Obstetrics and Gynecology says not if you're over the age of 65, actually, for pap smears, but you need a pelvic exam if you have a vaginal discharge, vaginal bleeding, vaginal pain. If anything changes, go in for an exam.
Can I just tell you a little caveat? So that is 100% correct. 100. Thank you, Dr. Whitmore. But let me just tell you just a little personal caveat. So there's also some fine writing in the national guidelines that say if your life expectancy is going to be 10 years or more. And how do doctors even know how long someone's going to live? Like, that's crazy. But my my phone just said a really weird thing. Okay, but my family, all my grandparents lived to be 99. I don't know what's up with 99, but they all lived to be 99. And my mother, when she was 78, just a year, 2 years ago, her doctor had stopped doing mammograms, and she felt a lump, and make a long story short, it was breast cancer. So thank goodness we found it early. but that could have been very different. Now she's a 2-year survivor, thank goodness. But, if we just stop everything at 65 or 70, those people that have longevity, I'm sure Dr. Timmerman has lots to say about that. And, this may not be like 100% medical textbook, but I feel strongly about, my patients that I still, have them do self-breast exams. I still, have them talk to their GYN, and the same with colon cancer. They stop colonoscopies at age 70. And my husband's grandmother, we thought she was going to outlive us all. She walked like 7 miles a day, and she was just young and spry. And they stopped doing colonoscopies, colon screening on her. And she got colon cancer at 82. Who knows? She could have lived till 99 as well. So I just think that that's something to think about. What do you think, Dr. Timmerman?
Oh, I definitely agree. I don't agree with this age cutoff thing, because not everybody is the same 75. Not everybody's the same 85. So if you mass and you said, yeah, I would have surgery and have it taken out, definitely get your screening. Because if we find something and it's going to be early.
Oh, looks like she's breaking up a little bit. Sorry, Dr. Timmerman. Timmerman. Why am I?
Simple lumpectomy, in and out procedure. And it's the problem. Oh, sorry. Am I back?
You're back.
Sorry.
Try it again.
Okay. So not everybody's the same biologic age to be able to undergo a surgery, no problem. So I say, don't stop the screening just based on an age cutoff, because not everybody's the same. So if you're 85, I have lots of older patients. I just operate on a 93-year-old. She's amazing. She had a lumpectomy. She's fine. She'll be great. But she kept doing her screenings. So if you screenings and you're willing and capable of going through a surgery, because it doesn't have to be an extensive surgery, just something simple, we can fix that problem.
Yeah, absolutely. So how do we as women stop comparing ourselves by the number on the scale and just go by how we feel and look? This is, I think, a very, very important question, and something that we need to talk about, because it's been a lot, especially over the last, year or two of the association of weight and health. And so this is a great question of how not to compare ourselves.
I feel really strongly about that, because I want to encourage my patients. Unfortunately, stepping on the scale is the easiest thing, right? We can just step on the scale and see a number. And I wish that could be for everything we do. I need a new cord for my phone. I wish that we could walk around our house one time and lose a half a pound. I also wish that it's not working well. I need another cord. Okay. So sorry, having technical difficulties. I also wish that, we could walk down the street and put our finger in a monitor and say, yes, we've increased our circulation and we've increased our memory. But that's not how it works. Unfortunately, stepping on the scale is the quick fix thing. But I want to encourage people that when you exercise, you are decreasing your risk of heart disease. You're decreasing your risk of diabetes. You're making your bones stronger. You're making your muscles stronger. You're improving your balance, so that as we get older, our balance will be better and we won't have those injuries. Remember the 4 Ds: danger, don't fall, avoid injuries. And it's been proven that when we exercise, we decrease our risk of Alzheimer's. So, people would say, well, why are you exercising after work when you're tired or whatever? And it's not necessarily to lose weight. It's those other intangible things that really help. Some people need it to sleep. They need to exercise to sleep. Some people need to exercise to, have better sexual health. So all those things make a difference. So
Yeah.
It's just
My
not
doctor,
as tangible.
yeah, my doctor has a saying that she always says about, in this country, we're obsessed with weight instead of health, and we need to focus on our health. And I think that's such a good, and it's talk about being preventative and staying on top of everything. It's so important. It's like, we've been trained through magazines and models that, like, oh, you have to be this number on a scale, but a lot of it is body diversity is real. And when you focus on your health and your overall wellness, that's how you realize, oh, there's some people with short legs, or some people with tall legs, or some people with brown hair, there's some people with curly hair, different types of skin and sizes and like, so no one's going to look the same. So if we focus on our health, because there's only one of us, the genetic makeup, right? There's only one of us on the planet. That's very powerful.
There's so many people that are malnourished, overweight. And that sounds like an oxymoron, but you can be malnourished. So and like, to your point, we're not one size fit all. There's people that are small bone, there's people that are bigger bone, but it's more about being healthy inside, knowing your numbers. And it's not always that tangible thing on the scale. It's those other things that really help us to be healthy as a total.
Yeah. All right. We got some really good questions coming in. So we're going to try to not do rapid fire, but just kind of, speed it along a little bit. Okay. So the next one is, I have dense breasts. Does that mean I have a higher risk of getting cancer?
That's a tough one. Apparently, there's a very slight increased chance, not one that we even attach a number to. But I think it's important to realize this and say, okay, my breast exam is going to be different. Do I need a screening ultrasound with my mammogram? So that's something to discuss with your doctor. And then they'll look at that, and then they'll say, okay, what is your family history? Have you had biopsies in the past? When did you get your menstrual cycle? How many kids have you had? So that they look at all those factors that can adjust your risk. And then, you may be in a higher risk category, but not just based on the density of your breasts.
Okay. Do you still need to see a gynecologist if you had a total hysterectomy?
Well, yes. Usually a total hysterectomy these days is more about having the cervix, uterus, and tubes removed, because most ovarian cancer is felt to be generated from the tubes and not the ovaries. So the ovaries are left. So you still need to be evaluated with a pelvic exam. Doesn't mean you need a pap smear, but you do need to go for a pelvic exam. And again, if you see bleeding, if you're bloated, if something, if pain, if something doesn't feel right down there, you definitely need to go. So you're not done.
If you had a hysterectomy and you do not have sweating spells, how do you know that you're in menopause?
Well, we can measure hormone levels. Something called follicle stimulating hormone is a good way to screen. And then you can do a formal hormone panel. And then the question becomes, okay, when do we start hormone replacement therapy? And what does that mean, given the evidence from the 15 years ago now that taking hormones is going to give you breast cancer, et cetera. But actually, even oncologists will allow their breast cancer survivors to have topical estrogens. And you don't need much. Just a little bit is going to make you healthy in the pelvic floor. And then you can be tested, even go on bioidentical hormones. We have a very good group of physicians here at Virtua that does that. Bottom line is you need to measure the hormone levels.
Yeah. How do you stay consistent with exercise? I have 5 adult daughters, 4 grandchildren who I babysit weekly, and I put everyone and everything above myself.
I mean, it's important to understand that you're important too. Your family needs you. And you have to take care of yourself, or you're really gonna run yourself down. But I would take those grandchildren that you're taking care of and take them for a walk. Show them that this is part of life, that we're gonna include exercise in our lives. And like I said, my daughters and I, we hula hooped on commercials. Many times I did not want to get up, but I was trying to model good behavior. I wasn't always perfect. But they would say, get up, and we would hula hoop. So try to incorporate your family.
Dr. Timmerman, you were going to say something.
Yeah, but my point was just, you always need at least a little bit of time in your day for yourself. So getting that little bit of exercise, clear your mind, take some time. Because if you don't take care of yourself, you can't take care of everybody else. You know, you have to make that time.
As someone, I do think that there are some people out there who love exercise. They get the endorphins from exercise, right? I'm a weird person where like I naturally am happy, and when I exercise, I don't feel as good, but I do find that there are things that I enjoy. I love to go on walks. I like to be in nature. And so I could listen to music or listen to a podcast, or if it's cold out, you can go and watch a show on Netflix and just walk on the treadmill. So I think, like you said, you found the hula hooping. You don't necessarily have to run a marathon or take a CrossFit class. You could find something that you genuinely kind of enjoy, that if it is only for 30 minutes, it gets your heart rate pumping. Maybe you meet a friend. There's little things that you can do that's making your body move and helping with that whole body mind connection.
Nicole, I also wanted to say that a lot of times people tell me that they're tired, or they're having problems concentrating, or their appetite has changed, or their sleep has changed. And I say that those are symptoms of depression. And I wanted to make sure that I pointed that out today. And one way to think about depression, one mnemonic, there's many, but one is to think about sad faces. So S would be sleep. So too much or too little sleep. Appetite, again, eating too much or eating too little. The D would be dysphoria, meaning like irritable or more agitated. The F is fatigue, just feeling like run down and just tired. The A is agitation. The C is concentration. The E is esteem, or feeling guilt, like you're just feeling really down on yourself, a lot of negative thoughts or a lot of guilty thoughts. And then the S would be suicidal thoughts. So if you have multiple one of those symptoms, you may be depressed, and I would definitely talk to your primary care doctor about that.
Yeah, that's good too. All right. Why are doctors reluctant to take patients off blood pressure meds?
So I don't know that it's reluctant. People have high blood pressure for a reason, and it's not just always just diet. So it's often genetic. And so if you come off your blood pressure medicine, your blood pressure eventually starts to go back up. And the whole point of treating someone with high blood pressure is to keep them from having a heart attack or stroke, or damage their heart valves, or damage their heart muscle. So there's a reason why we want your blood pressure to be down. And what people don't realize is it often goes up in the middle of the night. That's why many people have their strokes in the middle of the night, and when you're not monitoring it. So we don't want that to happen to people. And most of the time, people are not checking their blood pressure consistently at home. So they don't even know their blood pressure is elevated till they come to the doctor every 3 to 4 to 6 months. So it's not so much that we're reluctant to take you off, it's that we're reluctant to have something happen to you when we take you off.
Makes sense. Is it okay to laser hair removal your vagina hair?
Absolutely. There's as long as the person that you're going to is certified, and the facility is clean, and there's evidence that it is a certified place of laser therapy, and you can do a little reading as to what kind of lasers. They should be able to answer all of those questions, but certainly it has been shown to be safe and effective.
Yeah. This is just a statement that says, my mother was diagnosed with ovarian fallopian cancer at 74 and was also told GYN exams were not necessary after the age of 70. So that was just an example of that. I'm 60 years old. Are pelvic exams necessary if you had a part hysterectomy? Yeah, we already talked about that. And she said uterus and cervix have been removed, but I have both ovaries. So we addressed that it's important to still get checked up. Please address vaginal dryness not helped by Replens or hyaluronic acid. I think that leaves physical therapy, Thervia or Mona Lisa. Any suggestions who to talk about if either Thermiva, am I saying that right? Hopefully I'm saying that right. Or Mona Lisa can very likely help dryness and or narrowing.
Well, actually, the Mona Lisa Touch laser and the Thermiva are both FDA approved for vaginal atrophy or dryness. They are not approved to necessarily cure incontinence or other conditions, but they definitely work very well for improving the blood supply to the vaginal tissues, which will definitely help the dryness. They are not covered by insurance companies and can be somewhat costly, but for someone who has a strong family history of breast cancer, just doesn't want to take hormones, has failed things like Replens or hyaluronic acid, which actually works quite nicely, then those people might want to consider laser therapy, but it's not necessarily going to cure incontinence or prolapse or anything else, but it will increase the condition of the skin.
How effective are thermal breast exams in comparison to traditional mammograms?
Thermal ones, I hear about them every so often. Somebody will ask me that question. Stay traditional. If you want to use it in conjunction, there's lots of people that use sort of holistic things in conjunction with our, regular recommendations, and that's fine. But I wouldn't use it as an alternative to mammograms, ultrasounds, MRIs, that type of thing.
Got it. Okay. And oh yeah, I think that because we covered everything else. Oh, here's one more. Sorry. Wanted to talk about if you're not interested in sex anymore and your husband is I don't necessarily know what that means, but I guess maybe it goes back to desire and how to kind of get. And then another one is getting back to dating after divorce and menopause. So maybe we can tie those two in, just kind of making maybe women feel like how to get that zazazoo back.
Well, zazazoo has somewhat to do with hormones. So getting your hormone levels checked would be helpful. Being treated with topical hormone therapy or local estrogen may be very helpful. We can even have testosterone creams. Making sure you're moisturized, so to speak, whether it's hyaluronic acid or the laser. Use lubricants before, during sexual activity. And if there's other conditions that are wrong in the area, for example, if you have pain with sex, you're not going to want to be desirous of it. So get the painful condition treated. Bladder pain, for example, is very common reason not to have sexual desire or even want to participate in sex at all. There's a very high avoidance factor. So treating the bladder problem, if you have recurrent UTIs or infections, or if you have chronic inflammation in the bladder pain syndrome, there are many things that we can do to treat that. And once that gets better, then you can certainly deal with the sexual activities. Also remember that if you have inflammation in the skin, in the bladder, the muscles get very tight. And when the muscles are tight and can't relax, that definitely causes dyspareunia or pain with penetration or sexual activity. And that's where physical therapy has a huge role, because we do pelvic floor physical therapy, and one can learn how to contract and, more importantly, relax the muscles, in addition to treating the skin disorder or the bladder or the bowel disorder, and younger women, the endometriosis. So you have to identify each problem and treat them all, and then you can have pain-free sex. That's the goal.
Yeah.
I would say emotionally, also make sure, really search yourself and make sure that you're not depressed, because sometimes that can take away some of the joy. Sometimes it's your medications, and just kind of talking to your doctor about that and maybe tweaking that a little bit. And just FYI, there's other ways to have orgasms besides penetration. So there's other ways you can, discuss that with your partner, or I'm sure Dr. Whitmore could definitely talk more about sexual counselors.
Yes, there's a whole licensing area for sexual counseling, and there are many sexual counselors available. But talking about penetration versus, for example, clitoral stimulation, most women have orgasms with clitoral stimulation, 70%, as opposed to 30% with penetration. So there are different exercises that can be done. There's role playing, there's cognitive behavior. If someone has had a history of sexual trauma and they're willing to talk about it, we can send them for different kinds of brain therapy, electromotive desensitization. EMDR can be very helpful. So there are many ways that one can be treated. Bottom line is you have to admit that there's a problem, and you have to feel comfortable with your healthcare provider and talking about these things. Many patients don't tell because the doctors don't ask. So
Yeah.
I think in general, I'm so sorry, Nicole. Just real quick, I just think in general, we don't talk to our younger generations. So if they have a new partner or a new spouse or whatever, they think that there's something wrong with them if they're not having orgasms. But there's more than one way to have an orgasm. And if they've never been taught that, then they're going to think that something is wrong with them. But
yeah, and I think there's going to be one last question, but I want to say this too. I think it's really important for everything we talked about. There's a specialist for everything. There are really amazing women and men who can help you with anything. You just have to be comfortable enough to say that you want to get better, or you want to know you want to ask the question. So never, ever be afraid to ask the question. So last question is, if a large fibroid has calcified and is not causing any pain, is there surgery to save the uterus and only remove the fibroid from the uterus? OBGYN never mentioned that the fibroid could calcify.
They don't often, but they certainly can. And in fact, they can add 10 pounds and be as big as a small baby. And you can have something called a myomectomy, which is where you take just the fibroid out. Depends on where the fibroid is located and whether or not there's other problems with the uterus, tubes, or ovaries. But certainly a myomectomy can be performed in many cases.
Awesome. These are amazing questions. So before we wrap up, do any of you incredibly brilliant women who are so generous to donate your time today have any last piece of advice or information that you would like to share with our attendees?
I always, at the end of my talks, I always say that I wish you all the absolute best life has to give. But if you can't be the absolute best, we all can be a little better. And I don't mean that to say feel guilty about anything. I feel like we need to just listen to our bodies more and just try to help ourselves by reaching out and asking your doctor and making sure that we are self-advocates for ourselves and staying on top of our health.
Don't be afraid to ask.
Yep.
Agreed. And don't be afraid to get to know your body really well so that you know what's right for you.
Like we started this, don't be afraid to touch yourself, right?
That's right.
Yeah. It's your body. And if it's not functioning the way you want, like we said, please do yourself a service and make sure that you ask the question. Do not be afraid, because there is help. A recording of this session is going to be emailed to you in the next week. And a friendly reminder that Virtua has specialists in all areas of women's health to help you feel your best. So for more info or to schedule an appointment with women's health provider, just go to virtua.org/women. That's virtua.org/women. Thank you so very much for joining us. The fact that you decided to join us means that you want to ask the questions. You want to be a better version of so that is, that you're worth feeling better, which is so important. So know that you're worth feeling better. And thank you, Dr. Whitmore, Dr. Timmerman, and Dr. Patterson for another terrific session for Real Talk. Thank you so very much.
Thank
Thanks
you
for having us.
Thank you.